what have you and the U of M been up to in terms of fighting this pandemic?
We didn't have the shields, we didn't have the masks, we didn't have gloves, because that all has been bought away. The supply chain disappeared. So we partnered the medical school with the College of Science and Engineering and College of Design and have made all of that internally. We have realized that we have to test the people whether they have the COVID-19 or not. You need the knowledge, before you can make the decisions. We looked inside of the university and built the supply chain autonomously, independently from anyone, and were able to build the capacity that then got the attention from the governor and his group. And that's where we were asked, along with the Mayo Clinic, to put together the testing initiative that now has tested more than 500,000 people across the state, and is one of the most robust and most accurate testings, that we actually have. It's a multisystemic disorder that is, affecting a lot of parts of the body, including brain, heart, kidneys, because you either can look at this as a sort of an existential free fall, that things are happening like a tsunami of things, and you are just gonna wait until it goes away, or you can concentrate around the activity that we do well, and we are good at research and technology and clinical care, and focus that. And that gives not only the better outcomes to patients that need it and the community that we serve, but also provides a focus in professional and personal life for the people on the ground, the technicians, the staff, the nurses, the pharmacists, the clinicians. And that, I think, made a difference. We really felt that it has to have a series of drugs and interventions. Sometimes these are actually cells. They are not classic chemical drugs. Science is really important in this, because you can answer the way how we build the clinical trial, and that's the only way we can answer whether the drug is any good. So in some instances, we've shown, with others, of course, that the drugs are efficacious and should be used. And in some others, we said, no, it actually does not make a difference whether you are taking this drug or not. So we have had since about 19 clinical trials. They are still ongoing. We were trained for this. This is the whole clinical training, medical training, scientific training. This is poised and waiting, being ready for occasions like this one.
Are you hopeful then? I mean, we are going into flu season, which might make things worse, and we're seeing cases surge now.
Of course I'm hopeful. And this is not a sort of an empty, sort of a Disneyland kind of, hope. No, this is born of the history of medicine and history of technology. And, the brief one this year, 2020, and the little longer one, say last 2 centuries or so. And the reason is that science is the best method we have for understanding ourselves and the life around us. That's simple as that. It's better than magic. It's better than, alternatives, and it works. You have to deconstruct the problem and then, apply itself to the solution. The kind of hope that I am after is the gut level kind of hope, the deep seated one, the trust, in ingenuity of people and goodwill, because that is where I think people become the best versions of themselves when they apply themselves to a challenge. Because many, including myself, have during our professional and personal life, were faced with challenges that only when faced with that challenge, we realized what we are capable of. What we are seeing now, I think, is more a sort of periodicity of about 8 to 10 weeks that we see a wavelet, not a wave, perhaps, and we can, be prepared for this. Our readiness today, is so much better than it was even, 3 months ago, or let alone 6 months ago, that it makes the quote unquote flattening of the curve much more likely than before. It's not just the COVID-19, it is the flu. So people should get the flu vaccine, because if there is one thing that's worse than getting COVID-19, it's probably getting the flu at the same time you have COVID-19. We don't know yet, how they're going to interplay, but chances are it's not it's not the best combination. Very low key but very important measures like the distancing, masks, hand washing. It does not have to be that complicated to be effective. These low cost, low intensity measures are incredibly effective, and believe me, they are much better than coming to my hospital and getting intubated and getting all these fancy drugs. But most people understand that being sick is really not a good idea. And even people that are younger, that don't get typically very sick, do understand that if they get sick, they may actually infect their parents and their grandparents. And these are the people who are going to die. I think more and more is the benefits of understanding that this is a collective burden. This is not an individual burden. So people, as they are looking at the curves and predictions and the numbers, some of them are alarming, and some of them, I think, would be better served if they didn't look at the cumulative numbers every 5 minutes of their day. Because what really matters, is the small platoons that they occupy right now. What really matters is that group behaving? Is it as safe as it possibly can be? And in this way, I think that we can sort of domesticate the pandemic and then domesticate the anxiety that comes with the pandemic. The difference is the readiness of the medical establishments and the society. And everybody, I think, would wish that it was a little less confusing. But what really is in this is the phenomenal opportunity for people to engage in the best way and show their goodwill and good nature. And it is the enormously important increased confidence in science and in technology, because ultimately this will define what our society is going to be like. The language of understanding in the society is different. It's like a Babel, of languages. There are some groups within our society that don't understand each other. It's still English, but they don't. And they are, which is even worse, they are unwilling to understand each other. And in science, which is the sort of common denominator for, almost the best thing that ever happened in mankind, we really, that is difficult, because part of the things that we are seeing as a continuum of the medical problems and healthcare, which is the polarization of the society, I think, degrading discourse, in the society, and the private and public narcissism is a consequence of that refusal to understand each other. That's where I see a tremendous opportunity and almost, daily wonder at the privilege in this way only, the gift that I have been given personally. And I think many people feel that way, of being able to do something about that educational difficulty, that societal difficulty, that scientific difficulty. I think it's a life affirming energy.